welcome back to my channel. My name is Leah, and this channel is all about providing you the inside scoop on what it's like to be a PRN med-surg nurse. So on today's video, I want to talk about all things pertaining to CNA. Being a CNA, what you do, what a typical shift looks like. And yes, I am an RN, but in my hospital, a lot of times RNs are opted to work in the capacity of a CNA. And even last night, I was called in for an 8-hour shift to work as a CNA. And so I said, hey, let's sit down and talk about the nitty-gritty of what it's like to actually be a CNA, to help those who probably are nursing students and currently are CNAs looking to be nurses. Y'all, this is all, it comes full circle, okay? No matter if you pass your NCLEX and you're working as a nurse, more than likely you will probably have to be a CNA. Let's talk about this. So in regards to me working in an acute care setting, my hospital, and this worldwide shortage of nurses and CNAs, a lot of times when the staffing is falling short, we have to have nurses who work as, we call them PCAs in my hospital. Well, a lot of you know them as CNAs. And so I am a nurse that willingly volunteers to be a PCA. Prior to becoming a nurse, I worked as a PCA all throughout nursing school, and it was a rough job, but I love it because I realized that I can take care of my patient from all the way from being the PCA to the nurse. And sometimes I don't have to rely on the PCA because I can do the duties myself. And it's a great thing to be able to do that because a lot of times you will have to do what we know as primary care, meaning you're taking care of the patient and you're the nurse and the PCA. But in my capacity that I am now, I am a nurse, again, that volunteers to be a CNA because it is a break, it is a mental break for me. Sometimes having to be the charge nurse and being an RN, so a lot of times you just need the mental break. Also, not only that, I volunteer because it reminds me and takes me back to where I was before becoming a nurse and seeing things from a different perspective, to make sure I don't get, a high head. So that's how I have been allowed to work in the capacity as a CNA, because I volunteer and the charge nurses or the supervisors know that Leah does not mind being a PCA. So more than likely, if they don't need any more nurses, I'm asked to come in and I'm asked to be a PCA, and I do not mind. Okay. So what a typical shift looks like working as a CNA. So let's get into the hourly duties of what you will have to do as a PCA, what it looks like from start to finish. And I am only talking in regards to acute care setting because I work in an acute care setting floor. Primarily when I come in, again, I am a PRN nurse, so I picked up a shift. When I come in, I immediately go to the nurse's station and I go to check to see what set I have. We have about 26 beds on our unit. And so typically you have about 3 PCAs that split those 26 patients up. So I typically have about like 7 or 8 patients. And so I look to see exactly where I am. They split it up from, maybe like 1 through 8, 9 through, whatever, 18 or whatever. So I check to see where I am as far as where I have my set. Then I go put away my belongings, and then I come back and we have a specific sheet that has been formulated by our manager that kind of outlines all the different things you need to know when working as a CNA. As far as their diet, as far as their mobility, as far as what bathroom needs they need, as far as a urinal, things of that sort. And so that has the main things that you will need to know about your patient when you are getting report. It makes it so much easier. And so I immediately go in, I figure out where I am as far as what set I have. I write that down on a Post-it note. I grab that paper and then I stand and wait for huddle to be taking place. That lets me know the specific things I need to know about my patient, whether they're a one-to-one or video sitter, things of that sort, important things. And then I find the CNA or the PCA who was working day shift. And then once we do that and we find each other, we go to our specific section where my specific patients are, and that CNA provides me with report. Report in regards to taking care of patients as a CNA. First and foremost, you need to know the room number. You know the patient's name. You need to know how they go to the bathroom. As far as, do they use a walker? Do they use a cane? Are they a one assist? Do they need a gait belt? Can they get out of the bed at all? Are they bed bound? Do they have episodes of incontinence? So things of that sort, as far as bathroom needs. How do they go to the bathroom? What are their mobility needs? Can they get up? Do they need to have the bed alone room because they're prone to get up? Things of that sort. And so we need to know that. Not only that, you need to know their diet. Are they a regular diet? Are they NPO? Are they on a cardiac diet or carb control? And then from there, next in the line to their diet, you need to know, are they on AccuCheck? AccuChecks mean we're checking their glucose levels. Typically it's ACHS. ACHS means that we're checking it before each meal or we're checking it every 6 hours. Foremost, if they have specific needs, as far as a lot of people come in and they have urostomies that need to be drained. Sometimes they may have drains because they had surgery, things of that sort. So any special things you need to know in regards to that patient we let them know. Also, we let them know in regards to if they need blood draws, because at my hospital, PCAs are phlebotomists. We are collecting blood. And so we need to know whether they have a line. If they have a line, the nurse has to take care of that. If they are not aligned, just maybe if they're difficult, like any tips and tricks you need to pass along, execute that task of getting blood. So maybe go to their left side, their right side, things of that sort. Also, any special things as far as what they like, as far as treats and things of that sort to keep a patient happy and sane. Also, if they're a daily weight, do you need to take their weight once a day? And last but not least, in regards to the report, when they'd had baths. In my unit, we actually split up the baths. So during day shift, all even numbers get baths, and at night shift, all odd numbers, and everyone with a line gets a bath. And so that's how it's done. And so we kind of give an update and say, hey, I did do this bath. This patient refused a bath, so they may need a bath tonight, and things of that sort. And that is the entire report. Typically, report, depending upon how talkative the CNA is, typically takes no less than like 5 minutes. And from there, the first task is to take vitals. So once I actually get report, I grab a computer, I grab a vitals card, and I grab all of my needed supplies. When I'm stocking I'll try to put a picture of it, but we have a vitals card that has like little compartments. So in my compartment, I'm getting laundry bags, I'm getting trash bags, I'm getting my own size gloves, and I'm getting a marker and some wipes, just in case I need to wipe things down. Those are the main things that I carry on my vitals card. So once I'm going to my first room, I am assessing the room to make sure how clean it is. I am a person that believes that a room must be clean. If not, you should not be stepping into a room and a patient's room has dirty linens on the floor. You have trash that's overflowing, because that is not a conducive environment for a patient. So I am always checking my room, make sure it's clean. So when I walk into the room, I introduce myself. I believe that talking to your patient in a professional manner, whether you had a bad day or good day, you need to let go of that and walk into a room and let them know you're ready to take care of them and that you want to take care of them. So I immediately come in and say, hi, my name is Leah. I'm going to be your PCA today. And I know I probably hate saying this, but I have to say this because I have a big old badge that has the RN credential at the bottom. And I like to say, yes, I am a nurse, but on this particular shift, I am your PCA, serving as your PCA. I write my name on the board. I go to the patient's bedside. I look them in the eye. I let them know who I am. I state my name again. Hey, it's actually time to take vitals. Hi, such and such. I say, hello, my name is Leah. Hi, such and such. It is now time to take vitals. Is that okay? So while I'm taking their vitals, I try to be chit-chatty. I try to read off of their vibes and see how they are. If they want to be quiet, I typically do not say anything other than that. Once you're getting your vitals, you're checking their blood pressure. You're checking their heart rate. You're checking their oxygen saturation. You're checking their respirations. You're checking all the major vitals. And you have to be cognizant of the fact that when you are taking vitals, any abnormal vitals to basically inform the RN. Okay, and I'm gonna probably do a whole other video that explains why I say that, but it is important. And if you are unsure of what abnormal vital signs are, you need to actually go to a nurse, go to your manager and say, hey, can you create a card, or ask them to write it down so that you can keep it at the forefront. Maybe attach it to every one of your workstations so that you can be reminded of what an abnormal vital sign is. You should know so that you can let your RN know. Only reason why I say that is because working as an RN, we have so many things that we're juggling, and sometimes we're giving out meds, and yes, we should be checking vitals, but a lot of times vitals are coming in at different times and we may be in a cold or doing something. So stop what you're doing, however way you need to communicate to your nurse and let them know the abnormal vital. One other thing I want to make a note of is that if anything, as far as their oxygen level is basically abnormal, do not simply go to another room and ignore it. You need to find the RN, call them, and immediately tell them. And most likely, if you see their oxygen should be in their nose, mainly their nasal cannula or something's off, you can put it on, but I would immediately try to contact your RN so they can rectify the situation. Once vital signs are done, this is what I do, okay? And I believe that this helps me have successful shifts. You should ask the patient, is there anything else that you need? And a lot of times they will say no, but you need to survey the room and look. First and foremost, check to see if they're not MPO, check to see if their water carton is full. At the beginning of the shift, the water carton should be full because the previous PCA should have filled it up, but a lot of times people don't do their jobs. Check and see if it's full. If it is not full or the ice has melted, go fill it up. Ask them if they want any snacks. Ask them, is there anything else that they need so that you can smoothly go into your next room and you won't be piggy going going back and have to answer call lights from people that you have already seen. And so that is one thing that I do. I check the room also to make sure they have everything, as far as like, you know, linens and things to help to go to the bathroom. If they're a man, if they need a urinal, checking those things. If their bed alarm should be on, because you should know if they're a fall risk, checking to see that they have their bed alarm on. Just making sure everything is good. If you visibly see that your patient is in poop or they're dirty, you need to rectify the situation. Do not go and ignore it, or go do what you need to do and then come back and make sure that's the first task you do. So that is how I walk into a room and how I survey the room and take vitals for every patient. And so that is basically what I do for every patient that I have. I go in, I take vitals, I check to see if there's anything that they need. I visibly check to see if they need water, ask if they need snacks, and I go on to the next patient. So typically in an acute care setting, you will be taking vitals every 4 hours. So for my shift, we take it at 7, we take it at 11, and we take it at 3. So I do that every 4 hours. In between that time, your job in between those hours is to actually physically do hourly rounding to check if your patient is okay, check on them, ask them if they need something, and you have to go into the system. And we use Epic where I work, and we are actually checking hourly rounding to see if they're sitting in the chair, if they're in their bed, if they're sleeping, if they're laying supine, if they're laying flat, checking on them to make sure. Now, some specific things in regards to rounding on patients, a lot of your patients will be independent, which means they're able to go to the bathroom on their own. They're able to, ambulate on their own. So you don't need to go in there to help them. But if those patients that you have who are totals, who are unable to go to the bathroom on their own, you need to change their Pampers, you need to change their pads, you need to help them, you need to be checking on them every hour. And that means even sometimes rolling them over, checking to make sure that they have not been are soiled. If they're soiled, need to change them. That does not mean you wait till the end of your shift and let them sit in a poopy and peeing diaper. You check on them, and sometimes you can literally walk into their room and you can smell them. So if that's the case, change them. And one thing I want to say, and this is my little tidbit, a lot of times when people are totaled, a lot of times they can be pushed on their own. And I know a lot of people want to go into the room and have their nurse help them, but if you can push that patient, if they're feeling light, you don't need assistance. You can just push them to one side, change the pamper, do everything you got to do so that you won't inconvenience the nurse, because again, you are a support staff, you are a support staff to a nurse. So if you can do it by yourself, do it. It's okay. So hourly rounding includes checking on them, making sure they are okay, making sure they don't have any needs, and checking if the people are totals, that they are soiled, that you're changing them. So the special time in between hourly rounding, when I do my 3 o'clock vitals, it is a time to take labs. We are phlebotomists in my in my hospital, so labs includes me actually sticking them and getting blood specimens and sending them to the lab. I'll probably do a whole nother video on that, on how you can, if you do have to do that in your hospital, how you can increase your confidence in doing that, because it was pretty intimidating for me starting out in this hospital. Like, I'm a phlebotomist, I gotta do labs, but that is what I do. So I try to do that at the same time I'm doing vitals, so that I don't wake them up at separate times. Once that is done, if anyone needs a bath at that time as well, I am making sure that I am bathing them. So I go in, I do the vitals, I do the labs, put the labs where they need to go, and then I come back and then we're bathing the patient. And that's how I like to plan out my shifts. Typically, I will ask at the 7 o'clock or the 11 o'clock time if they prefer their bath, either early in the shift or later in the shift. And most people say later before you leave, and that's typically what I do. So that's what I'm doing at 3 o'clock. Also, when I leave the room at the 3 o'clock hour, I am checking the trash. We are responsible for emptying the trash. So I'm checking the trash, I'm getting the dirty linen bag out of the canister or the bin, and I'm taking all that and I'm taking it out of the room and put it in the trash or the laundry chute. So I'm doing a lot at 3 o'clock just to make sure that I'm prepping the patient up for the next shift. Now, typically what I do between 3 and 7, I'm still doing my hourly rounding, but I'm making sure water bottles and things and ice is melted, that I'm filling that back up, checking to see if they need snacks. And I'm just rounding on the patient between 3 and 7. And that is basically it. And so this is why sometimes being a PCA for me is like, I'm good. Let me be a PCA. If anything happens, the greatest thing I can say is, let me get your nurse. Oh my gosh, I love it. But one of the challenges I can say for me personally, when I was just experiencing this yesterday when I was being a PCA, is like, when I go into the charting system, I'm so used to having my nursing eyes on, and it's so hard to take that off and critically think. If you see abnormal vital and you see the MAR and things of that sort, is to take that nursing cap off. And a lot of times my roles can get overlap, whereas yesterday I was helping a patient, or I had a patient who's on a feeding tube. A nurse couldn't unhook the line from the feeding tube and I had to help and things of that sort. So they know that I'm an RN, I'm doing skin checks and things of that sort. So if they see me sitting down and a nurse needs help, I am asked to do a little bit more because I am a nurse, and it feels good, but sometimes it can be like, no, I'm a PCA, but I don't do that. Yeah, but it is a great break from being an RN. But I just want to say that these are the steps that I take as a PCA, and I expect the same if I'm working with a PCA for it to happen that way. But I realize a lot of people are not trained that way. One thing I can say is that being a PCA all throughout my nursing journey in school, it really did help me as a nurse, because again, I take pride in the fact that I can take care of my patient all the way from being their PCA to the nurse. And a lot of times you will have to probably experience that, and you don't want to be crippled by the fact that you can't take care of your patient who's a total. You can't change their diaper. You can't, give them a bath and things of that sort. You should be able to know how to do all that, because those are roles of a nurse. Okay. We are so glad for our support staff, and I'm so thankful that I have a PCA because it helps my days and my shifts go better. But I am not above anybody else, and I pride myself in helping my PCA. But those are the typical things you will encounter on a shift of being a PCA. And so I hope this was helpful. And you guys, if you have an opportunity to be a PCA, volunteer every now and then, just to give you guys just a different glimpse of what that life is like actually working as a PCA, so that you can be more empathetic to your support staff and your PCAs and love on them and be supportive and help them. So I hope this video was very helpful, but I have one more task for you guys. I want you guys to talk back to me. If you are a nurse in school, tell me, what are some of the challenges you are facing as a PCA? First, your working relationship with nurses. And then if you are a nurse, tell me, have you had the opportunity to work as a PCA? How was it? Do you enjoy it? Do you think it's a rest? Talk back to me in the comments. Don't forget that I have a free new nurse guide for you and my stand store. I don't know where you guys are in your nursing week, but I hope the rest of your week is blessed. And I'll see you guys in my next video. Bye.